Hello, my name is Olivia Wann and I'm with Modern Practice Solutions. Today we're talking with Ms. Jodie Cannon, who is our local HIPAA expert for our firm about HIPAA. So Jodie, tell me, what are the common infractions related to HIPAA compliance that you've observed over the last year and a half with dental offices?
What I see the most a lot of times is, number one, is either an improper risk assessment or no risk assessment at all when it refers to HIPAA. The second one that I notice is business associate agreements. They may not be on file or signed or maybe identified. And then the third that I notice is improper policies or insufficient policies or no policies at all in regards to HIPAA on the privacy and security procedures that are required.
So explain briefly what a risk assessment is.
Basically, a risk assessment just it's a series of questions in different safeguards, administrative, physical, and technical, that analyzes the vulnerabilities and the risk of low, medium, and high when it comes to systems and the security of where your patient health information is and your network connections.
And we understand that this risk assessment is required, is it not?
Yes, it is required. It's required by HIPAA. You should have one anytime that you're doing a major change in your system or updates, new software, additional equipment, added locations. That's when they require one to be renewed. We usually recommend every 3 years to have one for Modern Practice Solutions, because usually by then you've either added a location or you probably have improved or upgraded your systems.
And with larger organizations, it would be annually, or for those on the electronic health record, it would be annually as well. Now, when it comes to business associate agreements, would you clarify some of the hurdles that clients are experiencing?
I think for the most part, they're not exactly sure, the practices may not be sure how to identify what a business associate is. And so when we do a risk assessment, at that time we help and assist in identifying and helping the security privacy officer understand what a business associate agreement is, a business associate and the agreement itself, and then identifying those particular vendors as we go. And then also what I see is they're not signed. They just don't have them on file, or did not know, or maybe they have them with the vendor just unaware that they may have signed them. Another major thing is the reviewing of the business associate agreement. A lot of times vendors have their own standard business associate agreement, and sometimes that needs to be reviewed by the practice to ensure that's what the practice wants to have. For example, on a limitation liability for that.
So it's often written pro-vendor rather than pro-dentist if they're supplying them. And then when it comes to policies and procedures, would you elaborate there?
Yes, there are required and there are addressable policies and procedures when it comes to privacy policies and security policies. And so those are identified through the safeguards. Policies are separated through administrative, physical, and technical. And so all those policies are required, and what we see a lot of times when we're on site or through a risk assessment is those policies haven't been implemented or they're insufficient. They don't have enough information for the policy to be there.
So we're very happy to announce that Ms. Cannon will be teaching the advanced HIPAA course. It will be available at my law office. We limit it to 6 participants. It will be a 6-hour course. So if you'd like to register, please contact Heather at oliviawann.com or telephone 931-232-7738. Thank you.
Thank you.